Bismillahirrahmanirrahim. Now the topic of discussion is endometriosis. This is a short discussion regarding the morphology. Now, you should know the definition of the word endometriosis. I guess you know it by now. It's the presence of ectopic endometrial tissue at the site outside of the uterus. So this is the point you should remember. Endometriosis means that when endometrial tissue is present outside of its usual place. Now there are many places where this tissue can be found. Most notable are these 8 places in descending order of frequency, and of these you can see some notable ones are ovaries. The tissue can be found in peritoneum as well. It can be found in the large and small bowel. It can be found in the appendix, cervix. So there are a lot of places where endometriotic tissue can be found. Now, upon gross inspection, these can look like nodules. Okay, they usually look like nodules with either a red, blue, or a yellow brown color, and this is because there is presence of hemorrhage in many of them that gives its or clotted blood-like appearance that gives its classical brown appearance. On gross inspection, um, they can be present just beneath the mucosal or serosal surfaces at whatever site it has involved. Okay, so if present in the ovaries, many cases you'll clinically see many cases they're found in the ovaries. When ovaries get involved, they show a cystic appearance. Okay, large cyst-like spaces that can be found in the ovaries. They can be variable, 3 to 5 centimeter, sometimes smaller, sometimes larger. Classical appearance, what you should remember is that they are filled with brown fluid that looks like a kind of melted chocolate. And that is why they're known as clinically known as chocolate cysts or endometriomas. Okay, and this is because of the presence of brown fluid because of previous hemorrhage, etc. And this is actually the classical appearance. And now, microscopy. There are three main things that can be found histologically. One, endometrial glands. Second, its surrounding stroma, and third is the presence of hemosiderin or hemosiderin-laden macrophages or histiocytes with hemosiderin pigment in them. This is how it looks like on microscopy. Remember that on gross, it's more or less looks like a melted or liquid chocolate. In microscopy, this is a section of large bowel. These are the crypts, the normal crypts, and this is the area which is showing endometriosis. In the center, these are endometrial glands. Here is the stroma. On this power, hemosiderin-laden macrophages are not visible. This is a high power view. Again, the glands, and this is the surrounding stroma. You may or may not find the pigment-laden macrophages or pigment itself. In some cases, we usually say that 2 out of 3, these 3 should be present for a diagnosis of endometriosis. So this is it for now. Please let me know if you have any questions. Thank you.